The Alameda Health System Bridge Clinic is located at Highland Hospital here in Oakland. And it's a super cool place. We don't have appointment times. You can drop in Monday through Friday from 9 a.m. to 5 p.m. You can talk to a provider by telephone, same day service. We offer kind of general medical services, primarily centered around medication-assisted treatment for substance use disorders.
Bridge was founded as a result actually of a project that begins with pain management. If we open our eyes and see that the ER is a 24/7 place that has tons of resources, food, shelter, medicine, doctors, nurses, social workers, and it legally has to take care of you. That is a beautifully designed intervention to reach people who aren't able to be reached in other structures of healthcare.
COVID demonstrated to us as a healthcare system that we can move mountains. We can do anything to prevent people from dying. In the Bay Area, more people died of overdose in 2020 and 2021 than died of COVID. We need to be applying that same tenacity to preventing overdose deaths.
The Bridge program comprises training and working with all the ER staff to identify, recruit, engage people struggling with substance use disorders, and then backing them up with a consult service, so dedicated addiction specialists that are available during the day to provide a deeper level of care. And it started at half a day, once a week with 5 or 10 patients, and now we're, might see 150 in a day.
Our consult service linking to clinic is really powerful. And one of the huge barriers for consult teams is navigating insurance. But the reality at Bridge is we don't give a crap what your insurance is. I care none at all. If you don't have insurance or any way to cover it and you don't have cash to pay for your Bupe prescription, our pharmacy is going to get you access through grants that we've acquired, and that's game changing.
The substance use navigators, or we call them SUNs, are the heartbeat of our clinic.
A lot of our substance use navigators are actually HEPAC employees. They're harm reduction specialists that are stationed here at the Bridge Clinic. And so we have a ton of harm reduction supplies within the clinic. That kind of partnership is really rare in a county system. It's something that I'm extremely proud of in this space.
We help people get refills, and we call pharmacies for them and help people get mental health resources and counseling.
A lot of people already have a lot of issues. Trying to get health care shouldn't be one of those issues. Healthcare should be available for everyone, no matter what their circumstances are, no matter where they fall on the economic line.
One day I came here and I was telling them about a different medication that I take and some questions I had. And the pharmacist came out from wherever the pharmacy area is. Pharmacist came out into the lobby and talked to me for probably 20 minutes. I have never experienced a pharmacist coming to talk to me, so they really go the extra mile.
My role in the Bridge Clinic is to help with dispensation, access issues, and other things that come up with medications that patients might need, most notably methadone or buprenorphine. And also, along with that, getting access to patients for their 3-day dispenses of methadone to bridge them to a methadone clinic, or giving them doses that they need while they're here.
Another really key feature of what we offer is our warm line, a phone number. It's a cell phone that anyone in the community, they can call, or critically, they can text this phone number and get access to a human being on the other end, and that human being is a substance use navigator or a SUN. Have that navigator person support that patient, get all of their necessary bare minimum info to create them a chart in our system, walk them through initiating buprenorphine, get them the prescription at our pharmacy, be able to tell them that that pharmacy prescription is going to be free to them, work with them on a plan of picking that up within the next hour, all from a cold call. I find that incredibly rewarding.
It's pervasive how inequitable MOUD access has been. And we know that Black and brown folks are suffering more from the opioid epidemic and from overdoses and have less access to MOUD. That's because of bias and racism in our healthcare system. Places like Bridge are trying to address that on systemic levels, which is really important.
Month over month for the last 5 or 6 years, we have only increased in the volume of patients we've seen. Literally, we increase in the number of patients we see every single month. So that's enormous, right? We have not reached a ceiling in terms of meeting the demand.
We have people that come from all over California just because they know that they'll be taken care of at the Bridge Clinic. And that's something I feel I have a lot of pride in that. Yeah, brings me a lot of joy.